Been an entire week of somber anniversaries, 1 year since the coronavirus was declared a global pandemic and since the first cases were declared in Missouri and Kansas. In an exclusive interview, KCTV5's Joe Chiodo talks to a man who's been instrumental in leading us through this pandemic.
This week, I talked with Kansas Secretary of Health, Dr. Lee Norman, in his first in-person interview since the pandemic began. A sign in and of itself, things could be turning around. It's a story you'll only see on KCTV5.
With this kind of a pace, I've never worked this hard, and there hadn't been a single day off in that 412 days.
412 days ago, Dr. Lee Norman, who served as a doctor overseas in a war zone, was met with a battle of a different kind, one in our own backyard. On March 6, 2020, I met with Dr. Norman to talk about what the novel coronavirus even was. Now, nothing seems novel about it. 1 year, 529,000 U.S. deaths, and countless masks later, our conversation takes a turn.
The thing I'm most hopeful about most certainly is the vaccine.
Which begs the question, will this finally be over soon?
What over means is it will slip from being epidemic or pandemic to endemic. And endemic means like influenza's endemic. It just smolders along, it peaks sometimes, it drops sometimes. But this COVID-19 is going to be with us for a long time, quite possibly the remainder of our lifetimes. We'll get boosters and it'll probably eventually get folded into influenza vaccines, so we'll get hopefully one shot a year. But we're not anywhere near that yet.
Dr. Norman targets 2022 for the true return to normal.
I worry more than anything about fall and winter, just to see if there's any resurgence.
But he says this spring and summer will offer hope we desperately need. The CDC now saying vaccinated people can gather unmasked.
It gives people optimism, and for good reason. It's not fake optimism. There's reason to be optimistic. There's lights at the end of the tunnel.
After a year of business shutdowns, city lockdowns, and attitudes that are down, he knows people wonder.
Was it worth it? And I don't know that we'll ever know the answer to that. It prevented a lot of illnesses and saved a lot of lives.
He admits the mental impact of such drastic change keeps him up at night. He believes we are on the brink of even more loosened restrictions.
A little additional freedoms like that would go a long ways for people's mental health and how they feel.
But he says remaining vigilant is the only thing that will get us there.
What has me most concerned is that people will stop too soon with the public health measures that are clearly working. A number of cases, the test positivity rate, all those things are dropping. This is not Texas. We do not want to abandon masks and the other public health measures prematurely. That worries me more than anything.
Coming up in our next half hour, Dr. Norman will talk about what went wrong this past year and how we can learn from that if a pandemic were to ever hit again. Joe Chiodo, KCTV5 News.